Get ready for a game changer in the world of healthcare. Remote Patient Monitoring, RPM, is a digital game changer that's revolutionizing primary care. But here's the real kicker, it's not just about improving patient care, it's a revenue booster too. A recent study from Columbia University's Mailman School of Public Health has shed light on the potential of RPM to transform chronic disease management and primary care delivery. While previous studies focused on patients, this one takes a broader view, quantifying RPM's impact on practices as a whole. The findings, published in Health Affairs, are eye-opening. Researchers analyzed national Medicare data from 754 primary care practices that started billing for RPM between 2019 and 2021. The results? Practices adopting RPM saw a whopping 20% increase in Medicare revenue over the next 2 years compared to similar practices that didn't adopt RPM. And the best part? This increase wasn't just from RPM billing, it also came from added care management and outpatient visits. But here's where it gets controversial, there were concerns that RPM would reduce access for other patients in the practice. However, the study found the opposite. Practices adopting RPM actually saw more patients overall, especially those with higher disease burdens, many of whom were non-white or dually eligible for Medicare and Medicaid. Ariel D. Stern, co-author and professor at the Otto-Plattner Institute, University of Potsdam, said, "Our study offers cautious optimism that technologies like RPM can make primary care more accessible, proactive, and patient-centered." But they also caution that widespread adoption without checks could lead to increased Medicare spending. So, the question is, can we have our cake and eat it too? Can RPM boost revenue and care capacity without straining resources? The study authors suggest thoughtful reimbursement policies, like evidence-based limits on monitoring duration and patient eligibility, to ensure RPM sustainability and high-value services. What do you think? Is RPM the future of primary care? Or are there potential pitfalls we should be aware of? Let's discuss in the comments.